Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it all to you. Does a placebo pill have a place in medical research? We have been discussing this because everywhere the placebo pill is used as control for pharmaceutical research, but it is not really working, because if you have, for instance, an antidepressant drug, then this drug is toxic, and when you take a toxic drug, you feel that something is changing. There is an internal clue that you are on a drug, on a medicine, and this gives what we call an active placebo. So if you are to control for this placebo effect, you need to give the patient a placebo pill, but not a normal pill, a pill that also contains a toxic drug. We call this an active placebo. So you need to control with active placebo, and this has been done, and every time it has been done, the conclusion has been that there is no or almost no specific effect of the drug in use. Like the antipsychotic, the antidepressant drug is not working better than a random toxic drug. So, of course, it's extremely important, if you are using these kind of toxic substances, to be sure that there's a specific effect that is just not the toxic effect boosting some belief that makes it work. Makes it work. But this is how it seems to be today. That all the drugs we are using towards depression and psychosis are basically toxic drugs that, through their unspecific toxic effect, is giving us a belief, an enhanced belief in that we are helped by the doctor. And I don't know if it's good medicine to give people toxic drugs, telling them that this is good medicine, making them believe that they are becoming better, and using the placebo effect to improve their health. But what we know is that this only works for a short time, and in the long run, the toxic effect will dominate and harm the patient. So we know that these cures can only be used shortly, for a very short time. They're only rational if they're rational at all for a very short time. So in general, we can say that we need, if we are to use these drugs, toxic drugs, we need active placebo to control it. But that has been done already, and we know that there is no specific effect on antidepressant and antipsychotic drugs on the only interesting dimension, which is mental health or quality of life. Of course, there are a lot of effects on behavior, because if you are drugging people to hell, then the behavior comes down. So if you are psychotic and you are crazy and you're getting drugged, then of course you are less a pain in the ass for other people, because you're taken down. But then you could as well be shot or taken to prison. It's not really a solution. It's not curing you. So if we are looking at it from the patient's perspective, then we need active placebo controls. In alternative medicine, in holistic medicine, the placebo pill has no rationale. What you need there is a placebo treatment. You need another psychosocial intervention. And you need to use a psychosocial intervention which is proven not to be effective. And basically there's only one thing that is not effective. This is treatment by a pure therapist. Because a good therapist will make every method works. So the only thing you can use as placebo control in alternative medicine is treatment by horrible therapists. But then again, you cannot do it ethically. It's almost as bad as treating with poisonous drugs to boost the placebo effect. You cannot really randomize to good and bad therapists. So these kind of randomized studies cannot be done in alternative medicine. What you need to do, both in biomedicine and consciousness-based medicine, is that you need to measure the patient before and after treatment and see if you can actually help people. This is the only rational way to document that the treatment is effective and good. So you need to, if you want to control, then you take patients who are not in treatment, and they shouldn't. They should be comparable, which is also extremely difficult because in alternative medicine people are coming when they are ready, and when they are ready you cannot really put them on hold without damaging them. So you cannot really randomize to a treatment or a control group without treatment. So basically all the research designs we have, except measuring before and after treatment, is not scientifically valid. The placebo pill cannot help us out. The normal placebo pill without the chemical effect is totally hopeless. A placebo effect with a placebo pill with a chemical toxic drug is necessary when you're treating with toxic drugs. But in general, placebo pills cannot help us. These designs, research designs, are not good. They're not valid.